is a long-standing actually process. Started from 1984, this campaign to eliminate measles from Sri Lanka. In 1984, we started the first vaccination program, that is for the 9-month babies. Then 2011, we had the third vaccination program, that is for 3 diseases, MMR, measles, mumps and rubella. So therefore that one, by that time we have covered about 95% of the children, and that is there was a national immunization program. Under that almost everybody was covered. So the reasons due to this success is, there are so many reasons. One thing, all the children were registered under the MOH officers, the medical officers of health. We have a network around the country. They were registered in their offices. So and the other thing that they were followed by with vaccination. After that, there was a close rapport with our field staff, with the local community, and the vaccination was free of charge. We have our education also totally free. Because of that, the literacy rate is high, so they can understand about the value of health. Then you know how much they are convinced is that we had a 30-year conflict in my country. Even during the 30 years, with the 30th conflict also, we have about 99.9% immunization in my country, over than US. So the reason is, even during the 30-year conflict, the terrorist organization, the leader gave a 2-day ceasefire for this immunization program. Not only that, they allowed all our health workers to move into their territory, and they gave security for them, and they returned them safely, looking after them for the 2 days. So therefore, when they were liberated after the conflict was over, about 300,000 people came from their territory to us. Most of the people, some people, they didn't have their birth certificates in their hand, and most of the other certificates. But everybody had their immunization card in their hands. That is how much they are convinced about this program. Then the other thing is the rational decisions taken by the Ministry of Health, and also our national immunization policy we had in our country, because in 2014 we declared this policy. This policy gave actually equitable, high quality immunization service to the people of our country. The key challenges is to sustain this problem, and to sustain actually that we have to maintain this high coverage of immunization, continue. Then the standard of surveillances must be maintained. Then the third one is the continued financial support. We must continuously, though it is been eliminated, we have to allocate funds and for the maintenance programs, and also to continue the ongoing programs, that is to avoid any resurgence. Okay, and only one problem we have is the shortage of trained staff. So we have started a broad health worker education program, especially the lab services personnel. So with that, we want to actually answer that problem. And the other problem is now there is an outbreak of measles in other parts of the world. So we have to be very careful about the imported cases. So now we have taken a lot of measures. Even we know what the countries they have the measles. So therefore, when our people, the tourists come from those countries, we have to be careful, and we check whether they are anybody is ill, fever and all that. We do the checking. So we have found cases like that. So therefore, we treat them and deport as early as possible. I think this is a success story for measles. So we are not very developed, rich country. We are now, very recently we have come to a high middle income country. So still we have one thing, a free health service. Even if other countries cannot afford that, at least if they follow us, what we have done with all our limited resources, then they can make it a success.